Okay, so yeah, good afternoon, one and all. Me and my co-author, Dr. Amba Bocha, I will be presenting the paper titled "Global Summation of Youth at Risk: Special Reference to Substance Abuse." So I will be first of all, what is youth? So according to National Youth Policy 2014, as far as given by Government of India, the total population of youth is 27.5% of the population in India is considered as youth, that comes under 15 to 29 years of old. And according to United Nations, which defines youth as the category of that comes between the bracket of 15 to 24 years. And as we know, there are various organizations who has given the definition of youth according to their own database. So like Commonwealth has given the definition of youth between to 15 to 29. UNESCO has given 15 to 24. India has given 15 to 29. WHO has given 10 to 24. So these are the various organizations who has given different definitions of youth. Global scenario of youth, according to the World Youth Report, we can see that in 2020 it was published that 15 to 24 years of age number 1.21 billion and accounts for 50.5% of the total world population. And it also projects that by 2030 almost 1.34 billion it will reach, and by 2050 the United Nations projected that the population of youth will be 1.3 billion, that will be total of 13.8% of the overall population. And in Indian scenario, if we talk about, then the total youth population is right now is 27.5%. And who are youth at risk? So, as per the definition given by the policy toolkit in World Bank, youth at risk can be defined as individuals who face environmental, social, and family conditions that hinder their personal development and their successful integration into the society as productive citizens. And some risky behavior, including school absenteeism, risky sexual behavior, delinquency, violence, and substance abuse and abuse. And as per the National Youth Policy of India, the youth at risk includes economically backward youth, women, youth with disabilities, youth living in conflict areas, and youth at risk due to substance abuse, human trafficking, or hazardous work condition. So there are some types of youth at risk. Among these, the type 3 is very no who are experiencing severe negative consequences as a result of risky behavior, such as like who are drop out from the school, who are involved in this substance abuse, taking alcohol, and all this. So this is the framework that we have come up, and this is I will explain that first. What are the reasons when a youth get into this risky behavior? Peer pressure, family delinquency, poverty, family history, and juvenile delinquency. These are the reasons which leads a youth to get into this youth at risk behavior, risky behavior. And after getting into risky behavior, there are some types or categories we have come up, like substance abuse, crime, risky behavior, sexual behavior, addiction, and violent behavior. So these are the trait or kind of of a risky behavior youth. And after when a youth is in a risky behavior, what are the various consequences he will face, like economic, social, health, and cultural, psychological? These are the consequences that every at risk youth will be facing. And some global scenario facts I would like to share here, that in United Nations low income families, nearly 40% of the children from low income countries are at risk level, and 87% of the world's youth lives in developing countries. High school dropout are more than 8 times that likely to commit crimes in severe prison time, and only 1 in 10 youth from low income families go on to graduate for a 4-year college, compared to 28% from middle income families. So also, as per the study of Delaware Health and Social Service, we can see it was found that 20% of the children from low income families are charged with a crime by the time they turn 24. Before 24, 20% of the children were already having have committed some kind of crime, compared to 16% from middle income countries families, and 12% of children comes from high income families. So it shows like if you are belongs to the low income countries or developing countries, the crime rate will be higher than the high income families or countries. And when we talk about substance abuse global scenario, so among Americans aged 12 years and older, 31.9 million are currently illegal drug users. 11.7 of Americans in the age group of 12 and over are using illegal drugs. 53 million or 19.4% of the people of the age of 12 and over are using illegal drugs or misused prescription drugs within the last year. And 22% of male and 17% of female used illegal drugs or misuse. So that means males are more in number while using this substance abuse. When we talk about United Kingdom, among 17 years old in the UK, 1 in 10 have used hard drugs such as ketamine, cocaine. A study suggests. The University College of London research also showed nearly a third of 17 years old had tried cannabis, and more than half admitted to binge drinking alcohol. Cannabis remained the most common substance. That means 89% of the substance abuse that UK people are taking is they are taking mostly cannabis, and 31% of people perceived it to be easy to get illegal. That means they are not finding it very difficult to get access to get the substance abuse. When we talk about country like Canada, 60% of illicit drug users in Canada are between the age of 15 to 24, and over a third of students in grade 7 to 9 have been on alcohol. That means at very young stage they are at a vulnerable situation, and they're getting all these drugs, alcohol, and getting into the substance abuse risky behavior. Cannabis is the second most common substance and the first among illicit drugs used by Canadian youth. Lifetime cannabis use is reported by 17% of youth in the grade 7 to 9, and about 29% of 15 to 7 years old, and almost half of 18 to 19 years old reports past year are using cannabis. So when we talk about Indian scenario, as we can see,
you have 2 more minutes time.
so as we can see, alcohol use in India, 16 crore people are using alcohol, and out of 17, 16 male and 1 female is using having this alcohol. So that ratio of between men and female is 16:1. So this is the all about this alcoholism. Then next we can take cannabis use in India also 3.1 crore. This is the second most used substance in India, cannabis. After that, opioid is also using very much in India. So this is the recent report published by Ministry of Social Justice and Empowerment, a research conducted by AIMS and for the government. So we can see this from this that all the substances, what is the percentage of prevalence of their use, and these are the also some diagram taken from the same study. Like in the world, Asia and India, they have done some comparative this. So cannabis India is using 1.20%, and while world they are using 3.90%, and high on drug, this is also alcohol we are taking at the highest number. After that, cannabis, opioids, and so on. So this is about ganja. And contributing factors at individual level, micro level, and macro level. There are various factors which are leading youth to get into all this risky behavior. And when also it was found that when some young people, they want to come out of this drug abuse habit, they want to get out of it. So out of 100, only 25% of those got the treatment to come out of this, and 75 tried to quit but could not find any kind of treatment. And even all those 25% who got the treatment, only 44% could go to hospitalization, and rest 56 went to some other treatment. So this is the model that is the we propose here. Model proposed to reduce youth risk behavior among youth. How we can reduce this behavior? First of all, we need to comprehend the root cause, just including location and ambitions in the community, poor lifestyle and infrastructure, status of education, aspiration. So these are the factors that is the root cause of the how a youth is going to this risky behavior. And then we need to adopt some preventive approach, just like generating awareness, engagement in productive work, either of parents as well as kid also, accessibility and availability of educational opportunities, skill development, entrepreneurial activity. We need to involve them in entrepreneurial activities where they can divert their mindset from these illegal activities to some productive activities. Some career counseling, this is very, very important, because if we are not unable to guide them, then they will be getting into all these illegal activities. So we need to proper guide them and counsel them. And if we put up all these methods, then definitely we can transform these risky behavior youth into at productive and self-reliant productive workforce for the country. So I will conclude by saying that inclusion of youth involving in risky behavior is predominantly increasing in almost all parts of the world, including India. There is a need of comprehending the root cause and adopting preventing approach to reduce risky behavior among youth. All the stakeholders should come together, including education institution, corporate world, and development sector. So a triangular approach we need to adopt here to work in this area and make and train the youth as productive workforce for nation building. So this is the references. Thank you, sir. Thank you for the opportunity.